Hello, Vincent Carroll. This is tutorial number 55, postpartum preeclampsia. Preeclampsia means generally a rise in blood pressure and protein in the urine, and it can occur pre-birth or post-birth. And we're talking in this tutorial about post-birth, about postpartum preeclampsia. Very often it presents within 48 hours of delivery, but it can manifest up to 6 weeks after delivery. And its main manifestation for most people tends to be a persistent headache. It may throb, it's very dense, and ordinary over-the-counter medication does nothing for it. It can be a medical emergency if there's protein in the urine, because it's often associated with a rise in blood pressure, generally a diastolic, maybe over something in the region of maybe 160/90 plus. So it is serious, and it can manifest postpartum, hence the word postpartum preeclampsia. So what's causing it from an acupuncture point of view? Obviously, the whole birth process is demolishing of yin. Yin and blood are associated with each other. I wouldn't go so far as to say that yin is blood and blood is yin, but certainly blood is more yin than yang, although it does move and it does warm, but it's also a nutrient in the body, so its characteristic will be more yin than yang. But obviously within the whole world of acupuncture, there's nothing totally yin or totally yang. But nonetheless, when blood is deficient, perhaps post-birth, then yin is deficient. And if yin is deficient, yang can rise, and it rises under predictable channels, the three greater yang channels, the gallbladder channel, the stomach channel, and the urinary bladder channel, and also I find on the Sanjaya channel as well. So blood pressure can be associated with the rising of yang. Trouble is, it doesn't often produce clinical symptoms, so we have to look for other symptoms. And the obvious symptom that people will experience is headache, and because people experience headache, they seek medication, they seek medical attention. And if there is a diagnosis of postpartum preeclampsia, you will be admitted into hospital. And there will be an attempt to control the blood pressure and give pain relief for the headache. But the most important thing will be the control of the blood pressure. But from an acupuncture point of view, the most important question you must ask is, do I treat the manifestation or do I treat the root? And in fact, you treat both together. There's no reason why not. But to treat the root means treating yin. It means tonifying yin. It means Ren 4, and I believe in kidney 1 bilaterally, and even perhaps gentle electroacupuncture on kidney 1 bilaterally. Just a tiny little amount where the person would have a consciousness of a slight throb, that is all, and that gets the best out of kidney 1. And of course Ren 4 is a marvellous point as well, and pericardium 6 and heart 7 as well, just from a relaxing point of view. Maybe yin tang, the person needs obviously a good sleep, which is also a yin enhancing experience. So you have to tonify yin to keep the yang down. Now of course you can drag the yang down, and we will do that anyway, and we will drag down on the spring points of the greater yang channels. I mean, obviously, urinary bladder 66, gallbladder 43, stomach number 44. We've spoken about that many times on other tutorial videos. Also, I would use liver 2. I would throw everything at taking the yang down because it is a medical emergency. I would also do a spleen 10, because spleen 10 tonifies blood. We often forget about that fact. We think of it as something that moves blood and cools blood, but it also nourishes blood as well. And blood is portion of yin, and yin is deficient post-birth. So therefore, tonify the yin at the same time as dragging down the yang. And the purpose for that is, if you drag down the yang, the headache signs and symptoms will probably abate or disappear. And again, that's a yin enhancing thing. The person person sees progress, the person sees light at the end of their tunnel. And if that happens, that promotes yin as well. But you've got to promote blood and yin. So Ren4 and kidney 1 bilaterally are the most important points to make that happen. And drag down just to keep down. And then when all that's done and the patient then goes home and the blood pressure is settled, consider tonifying. I mean, tonifying the root of post-heaven chi, for the very simple reason the person has had a lot of their chi obviously used up in the whole birth and pregnancy process. And naturally with a new baby, they're going to need all the root of post-heaven chi that they can possibly have. So tonify after that. You can tonify safely without a risk of blood pressure or without a risk of the preeclampsia reoccurring. But to recap, 2 things. Treat root, treat manifestation. By treating root, you're tonifying yin. By treating manifestation, you're dragging down. And then take it from there. Thank you.